I got one here that has an active IgM, and can the IgG mean you are still positive? Yes. In a Western blot. Now, I'm not talking about an IgM titer, IgG titer. I'm talking about a Western blot. If Quest test or LabCorp's test comes back positive with 5 or more bands for an IgG, and you have any symptoms, you still have active infection. Okay? If you have less than that, now it gets a little trickier because I got to talk to your physician when they call me and discuss what bands are indeterminate by IGeneX or what they're seeing, and I can't make a definitive statement on that. But yes, more than 5 positive in an IgG, you have active infection. How active? Okay. Does Mayo lab test? No, it does not. It uses the Mardex blot. When somebody asked me, does the Mayo lab test include 31 and 34? Problem is that Dave Persing, an old friend of mine, left Mayo about 4 years ago because they don't pay much, and he has 5 kids, had to go to college, so a guy named Gates hired him out in Seattle to do research. And when he left, the ability to do really good testing at his location fell to the CFOs, who decided that cost is containment is probably more important than the most accurate test you can get. But they're still trading on their name, so the Mayo will tell you they do a great test, and they're using the same blot that Quest and LabCorp are now. They're using the Mardex blot, and guess what? It misses 31 and 34. So no, it does not include it. How accurate is it if you have received the antibiotic in the first 4 weeks to 3 months? You have cured the disease? No. Maybe. This is the toughest question. The person who got antibiotics, now I need to know what dosage. CDC has this wonderful thing that says 100 milligrams twice a day. That's a bacteriostatic dose of doxycycline. Bacteriostatic dosage are wonderful in bugs that reproduce in 8 to 12 minutes. They're not so good in a bug that reproduces in 24 hours and has a life cycle of a month. Yet that's what you're using for Lyme disease if you're following the IDSA guidelines. What that happens then is if the bug is strong and virile and smart, it goes into the tissue and hides when it starts to get attacked. And so you may not have the symptoms for months again. And for the first 2 to 3 weeks, you're going to feel better because the bug is running, it's not attacking. Okay, so cure, no one likes to say cure. I think a lot of people do get cured if you catch it early enough, but I am deathly afraid of 100 milligrams twice a day for 2 weeks, because that's what probably this person got. And unless you got it in the first 3 to 4 weeks before Borrelia had time to sequester, you could have a problem later on. Accuracy of a blood test. Okay, that is based between sensitivity and specificity. When you do a screen test for anything, it's called, you look at sensitivity approaching 100%. What that means, if it looks like, feels like, could be, isn't a distant relative of the disease you're looking for, you want that screen test to be positive. That's sensitivity, how sensitive it is. Everything that looks like it, it is. Now, specificity is different. Specificity means it is exactly the bug you're looking for. So you want sensitivity high in your screen test so you don't miss anything, but you want specificity to be through the roof for your confirmatory test so you know what you're looking for is actually what you got in the screen test. Okay? Now, in Lyme disease, of course, none of this plays out well. And it works the same for both Western blot and ELISA. Okay. Can the Western blot test tell exactly when you were bit? Absolutely not. Okay. It can tell you if your body is producing an IgM response, which is an active infection. In virtually every case, I don't believe in post-treatment Lyme disease syndrome. If you've got an IgM active infection, you have an active infection. And anything that's immunology 101, and it hasn't changed in 100+ years. And to come out now and say that, oh, it isn't active anymore, which the IDSA says, if it's one disease, is, to my estimation, ludicrous. So, can the Western blot tell exactly when you were in bit? No, it cannot. An IgG usually means you've had an infection for some period of time, be it better than 6 months. IgM start to come up in a good immune system at about 3-4 weeks after bite. Should go away about a month and a half to 2 months after that, and IgG should take its place. IgM is more like a scatter gun, so if you're into hunting or anything, it's more like a scatter shotgun, where an IgG is a rifle with a scope on it. Your IgGs, you're going to have a lot of them floating around to absolutely specific diseases. So when you get an IgG antibody, that is far more specific than the IgM. Does lemon repellent work? I have no idea. Only thing I could direct you to is, he's hiding. They might have studied it or tested it. I know that, I think Tom Mather at URI may have looked at that. So you could check out that website. It's called tickencounter.org. They have tested most of the things and see if they work. You could check with them. I don't know. Is Borrelia considered a co-infection? Well, not specifically, but the problem is if your immune system is suppressed, and Borrelia is the underlying thing forcing it down, all of these other infections, but a co-infection is supposed to be specifically from that tick. From that bug is where you got it. Didn't get it from something else. So we're not going to see this come out of the tick, but if you've got it in you and your immune system's been keeping it in check, and all of a sudden your T cells and your antibodies start to suppress, your body is going to be open to a lot of other things. That's why people are sick for weeks. They can't get out of bed. They've got all these other things happen. And it isn't necessarily that they got it from the tick. It's just that their immune system up to then had been robust and was able to keep everything in check. And then all things fell apart. IGeneX recently gave a presentation. Oh, it's sponsored by the, well, that's nice. And stating that Lyme patients were likely to be PCR positive in the first month. Yes, I believe they could, but, remember, if the bug is still floating around in the tissue, in the blood, then the PCR is going to pick it up. I think that works really well, but in our hands at University of Connecticut and at when I ran my lab in Gaithersburg, or before when I did this at MIT, at my lab at Collaborative, our studies have never shown a strong correlation with PCR early in the disease. Doesn't mean it doesn't happen. That was only in our hands. And yes, it could be, but a T cell response is a far better assay for early. Because T cells are going to be, because my bigger problem with the PCR is the answer I get from all these doctors, infectious disease, that say, oh, it's dead bug. They got DNA floating around, they just haven't cleared it yet. No, a T cell response, even your local neurologist won't argue with you. A T cell is an active infection. So a T cell response actually is better. Wow, I got the questions. Is that it?
No, we're going to have blanks for 20 minutes.
Oh, okay.
Yep.
Sure. In CBC. Why isn't the immunosuppressant reflected in this complete blood count? There's a lot of other mechanisms going on here that are keeping your parts of your immune system and your blood counts up. So that's why it's not. Your body is compensating. Your body will compensate for this bug as long as it can with a lot of other things. So therein lies the issue. That's why it says here, why isn't immunosuppression reflected in the CBC and the lymphocyte-monocyte shift? Because the body is compensating. It's compensating in part of the area, but it's not compensating in the specific area of a response by interferon to the bug. That's a pretty involved question. Okay. Anaplasma, Babesia, and myomatoid. Borrelia, how can Borrelia be destroyed if it can camouflage itself? I think that's a great question for Dr. Stram. sorry, Ron. That's what you get for sitting there. No, I don't want to load him with it. It can be destroyed, but you've got to have a bactericidal dose of a drug, and you've got to do it at a high enough dosage. The Babesia, we know that the malaria drugs will destroy it, given a high enough, long enough treatment. You're not going to kill these things in 2 weeks. Okay, once you've been infected and it's sequestered in your body, you need a pro like Dr. Stram or Dr. Horowitz, because you're going to have long-term needs that this bug is affecting, and you can't do it in 2 weeks of 100 milligrams twice a day doxy. Okay. I'll let you.
So that is a very good question. It's from my sister-in-law, so I think I was totally set up. But as you'll hear, hopefully from my talk and Dr. Horowitz's talk, this is significantly more complicated than just a simple infection. There's not only the fact that you have a single bug that causes an immune suppression almost immediately. So in fact, testing is so problematic because of that immediate suppression. It tends to suppress IgG responses, which is how your body actually kills it. So it's much more complicated. It maybe even promotes a more IgM response, which in some animal models show that if IgM is high, it makes the response from the IgG response lower. So if that's not only a problem, it's the fact that it forms these quorum sensing, right? This idea of that it can change its molecular structure, its DNA structure, so that the body then gets confused. What is it? Then there's the other problem that it likes to hang out in groups, which means that it sort of forms these colonies with other bacteria, other microbes, forming biofilm. My belief is that biofilm may be really what is some of the answers that could potentially actually cure it. And there is some really good research out at Drexel University with Dr. Ehrlich, who is looking at specific biofilms to really use to help penetrate it and activate a better response from the antibiotics. But that's the end of the story.
That's okay.
Anybody?
So I have a patient who are like erythema migrans, the Western blot. Oh, I'm sorry. Western blot, IgM positive, 2 bands. Started them on doxy. After there's at least 3 months of doxy, retesting. 6 months after, they still have never, like, I guess it's seroconvert to IgG, but the bands have changed from 2341, now it's like 4139. So is that the protein, is that how it's hiding? And how long, so they're on prolonged, this is actually a 16-year-old, so they're on prolonged treatment. Are they still, do they have Lyme? I mean, I don't know, when do you,
Okay, so many, I'm not a physician, okay? So many ILADS physicians will add Plaquenil or Flagyl. Or if you're a naturopath, you can use cat's claw rather. What you need to do is the doxy is not breaking the cell wall in the tissue. So all you're doing is hitting it. At our laboratory at UConn, I was able to take Borrelia burgdorferi, put it in a beautiful plate, and pour doxycycline over it. And it was like swimming. It was like in a pool. It could care less. Doxycycline will not, cysts will not get broken by just with doxycycline. The cysts for Borrelia. You need to weaken the cell wall. So it's not going to seroconvert because you're hitting it with the doxy. It's going into tissue, and every once in a while, when the person gets stressed out for something else, more than likely it's just coming back. Bang, up comes the IgM again with different bands because it's quorum sensing. It's changing its surface presentations. But you're not, the root of the problem actually is the cyst form. You're killing it as it comes out of the cell into the blood, but you're not getting it in the thing. Now, I always warn docs, make sure their gut is clean. Because if you add 3 to 4 weeks of Plaquenil or Flagyl, you're going to have a huge kill rate. And it's going to come flying out, especially if it's been around a while, and you're going to overload the gut of the patient. So you've got to make sure their gut is really clean, and don't do what my old friend Birascano would do. Joe's not here, is he? No, and you know, no. Take it easy. Start them, keep them on the doxy, and most ILADS doctors would want to add one of those cyst busters 2, 3, 4 weeks in, go for a month, pull them off. That should effectively get rid of the cyst form, and your patient should get better.
Okay, because initially they were on, I think, ceftriaxone, and then we switched them to doxycycline.
Yeah.
And like I said, he's 6 months out, and the IgG just keeps...
No, it's going to stay.
IgM,
Yeah, the IgM isn't going to allow it to change over because the body doesn't have enough energy to change that IgM, which you keep seeing. When the body keeps seeing this IgM come out of the tissue, and it's coming out with different proteins on its surface, and so the mechanism of the immune response to change from the IgM to the IgG is always going to get short-circuited here. And you're never going to get them over to a nice IgG, okay, without killing the cyst. Okay? You're welcome.
Can you please talk about band 41, which seems to be kind of a confusing...
If there's anybody in this room that doesn't have band 41, there's something wrong with you, and I want to talk to you. Because 41 is a flagella, which is effectively a tail. And they're pretty much all the same in all the bacteria you got in your body. So a good test should always pick up band 41. It does not mean you have Lyme. It means you've got some other bacteria floating around. When there is a band that is specific for Lyme, along with the 41, the CDC tells us in labs, we can then say that 41 is the direct relationship to the presence of Borrelia, because the other specific band is from Borrelia, Burgdorferi, or one of the sensor lot2 strains. So we know that when you see a 41 by itself, you've got a bacteria, and I just don't know what it is. Okay? Let me do this one first. Why won't the Department of Health approve your full test? The reasoning is New York State, there's a disconnect between legislature and the money they give the labs in Albany to test other labs. So if the research facility in the Department of Public Health in Albany doesn't have the money to look at and run the same specific tests that the labs like IGeneX does, because we continually develop them, but they don't have the money because they keep getting cut funding. They don't have the money to run the test. So the guy in legislature, all he's doing is cutting revenue or numbers, make himself look better, but when he cuts the funding for the Departments of Public Health to do testing in-house, he effectively slows down the ability of your state to go ahead and say, and bless a test. And for better or worse, you have laws in place that say they don't believe all the work done at other states. So in California, our Department of Public Health and CLIA, the Clinical Licensing Improvement Act, which is in all the states, have come to our laboratory on a quarterly basis or whatever. We submit everything. I can tell you that we've submitted our immunoblot to the CDC. They couldn't believe it, how good it was. It's allowed everywhere else in the United States. They've actually helped us write a letter to your Department of Public Health to get the immunoblot up and running here and allowed. We'll see if that has any effect. But that's the reason. They just don't have the money. Thank you. Hope it helped. Let's hope it helps.
Thank you. Thanks. And I assume on this we don't have a Miyamoto test
no.
because
Not
we
allowed.
didn't ask for it.
Not allowed.
Okay, got that part. We do have, or we were told that we have the B. Hensel at the Bartonella IgG
Okay.
positive. Doctors here in this community have told us you don't have Lyme, you don't have the co-infection. Don't worry about it. What you're seeing in your son is not accurate. We went to Cleveland Clinic. We went to Presbyterian, New York Presbyterian. and negative Lyme testing. So when we came up here and we called the Mayo Clinic, and they no longer even take patients that are Lyme patients as of 2 months ago. So it seems like it's a big controversy over the credibility, and the doctor that we're working with says, don't even tell anybody you're talking about Lyme, okay? So my question to you is, does that Bartonella, even though they're saying don't worry about it because he's got the stria, he's got everything, you know, we've got all the clinical parts of it, and they're saying it's an old infection, don't worry about it, it's not affecting him. He's lost 80 pounds.
So it's not affecting him.
I'm just asking you. He's 122 pounds. He's 28 years old.
Exactly. That's why we have ILADS trained physicians in your state. That's why legislation's trying to get these guys protected. The problem is, and you'll see this with you'll see this with any test. When you get a Lyme test, and even if Quest gives it positive, I've had doctors say, oh, it's a false positive to their patients. Yet if it's negative, it's always accurate when it's a negative test. Always, never misses a negative. It's a different set of rules that they incorporate by effectively moving the cup with the thing under it quicker. Bartonella, psychiatric issues often develop later on. If you're not going to someone like him, I might want to suggest, now Brian Fallon's an old friend down at NYU, but I don't know if he's not practicing anymore, is he?
He's practicing, but he's not taking
New
patients.
patients
He's doing
anyway.
research. And we do have a good doctor. We're just like when we go in and have issues with my son, it's like, well, don't worry about that because he doesn't have
That's
it.
fine. Then what is the cause of his losing the weight?
We still haven't found that out yet. We've been to a geneticist. We've got 7, 8 specialists.
So you got an elephant in the room with a positive lab test that can't cause these symptoms, and yet that's not the cause.
Can you just tell me, is that a positive lab test, or is that when the infection control doctor saw that and she says it's old?
Your IDSA person, yeah, it is. It's probably an old infection, but it's still active. It's
That's the part I want.
It's active. It's active infection. You need a Lyme specialist, please. Thank you. Based, how are we doing? Okay. Based on your knowledge, which is very limited, issues with quorum sensing, do you think it is ever possible to create a Lyme vaccine? Yes, I believe it is. I believe there is a vaccine capable, but as I tell doctors all over the world, there are a lot of lawyers in the world, and 74% of them live in the United States. With what happened to SmithKline with their Lymerix vaccine, made a lot of lawyers rich, made a lot of lawyers who are corporate at major pharmaceuticals scared to death, and whenever a company such as Baxter, which was developing a vaccine, when it gets to the point where they've got to go push to shove to really put money into it, they get before the board where there are 3 or 4 lawyers sitting, and they go, okay, we can go after Alzheimer's, we can create all these other things that will make everybody who owes stock in us very rich. Or we can go after and go down the same road that SmithKline did. Spend $30, $40, $50 million, take a bunch of our researchers, stick them on this project, develop a vaccine, and then we'll get our butts in. And we'll be forced to take it off the market. So Lyme has a very, very bad taste in corporate America, especially pharmaceuticals. That's why Baxter is trying to sell its research, which was very sound. And when the NIH does some work down there, even in Building 36 with Francis, Lyme disease is not a place that anyone wants to hang their hat. They can't get published. As soon as you try to publish something on Lyme disease, at any of major teaching journals, it always goes to the good old boy network, and it never gets there. But that's not to say it isn't. Now in Europe, I know that there's a company building a vaccine. It'll probably be available in Europe in about 3 years. But remember, vaccines take a long time to develop anyway, and when you add in the pressure from the pharmaceutical companies to not fund it and to fear by their legal streams, you're going up a very long, hard road. Now, with the increase we've seen in the government and the push by it and by Lyme support groups taking their legislatures to task, we are seeing movement toward protecting these kind of things. And like it or not, we're going to have to protect one of the big pharmaceutical companies that's got the guts to take this on. So we're not going to be able to go after them like people, those group of little lawyers of 112 people did in 2001. We're going to have to protect this pharmaceutical company that's going to do their best to develop a vaccine that helps. And I think a genetic answer is probably there. So, last one. If IgG stays forever, no, it stays for usually 3 to 5, maybe 10 years. How do you tell if an infection is cleared? If IgG medical, okay. There is no proof of cure test. Okay? Bad news. There is no proof of cure test. I'll say it a third time. There is no proof of cure because I got guys out there selling lab tests that will tell you you're cured. There is no test for proof of cure. I can give you a T-cell response, but that's only active infection. You still could have it sequestered. There is no way we could find out if you have any Borrelia left in your body unless we took your entire body, crushed it up like we do in a lab, like a tick, and look for it in every section of your body. We could find out if you're cured. The bad news is we're killing you. So we can't do that, okay? There is no proof of cure, and I can tell you that 3 to 4 years or a year after you're done, maybe an IgM, if it's negative, and that might be it. But I've got friends who actually, back when I was at UConn, we actually used some of the residents, as guinea pigs. And we injected them with the vaccine, the Lyme vaccine, and it was a 31 OSPE vaccine. And they're still positive 20 years later. So if the immune system's working, you may see that IgG going on for years. Usually it's a 3 to 5 year system that it clears out the IgG, but I can't say that because I don't have the data.
Hi, Bob. Thanks for coming.
Thank you.
Just curious, I have a house in North Carolina. Has there been any studies done in regards to chiggers, if they pass infections?
I don't have any solid, nothing. I'm not gonna, I can't go there yet. I got one front right now, one battle front. I get doctors don't want to believe Borrelia is passed by scapularus tick. So and now there's a mosquito population that I don't know about. Yeah, and the only person you should ask, he's sitting there. Oh, Ralph, grab him. Yeah, because she knows a lot. Go to her booth. She knows what she's talking about.
Okay, great.
Yeah, okay, I'm sorry I don't have that answer. Hey, thanks for staying awake.